Let us go now to self-testing for everything from allergies to HIV. And if you can save yourself a trip to the doctor's office, you're probably thinking, why not? Might actually save you some money, too. But do they really work? Women's Health contributor Dr. Keri Peterson joins us now. Welcome.
Hi,
Good to have you
Jane.
here.
Thank you.
You're starting. Let's start right off. I
Sure.
mean, what is the validity of using some of these home tests? You're going to give us the good, the bad, and the ugly,
Yep,
right?
thumbs up or down.
Okay.
Let's do it.
Cholesterol tests.
So this is done with a finger stick. You put the drop of blood on this little device, and it gives you your total cholesterol reading. Now, the total cholesterol is a useful number, but it's not enough information. You really want to know your breakdown of the good cholesterol and the bad cholesterol. So this is a skip it.
Okay, so for example, I have much better good cholesterol than I do. I have really high good cholesterol. So that's going to just tell me that I've got a really probably bad overall cholesterol rate, right?
Exactly, because your total is a combination of a good and a bad. So if your good's high, your total goes up, and that can be very misleading.
Yeah, too much information or not enough information of the right stuff.
That's right.
Now let's talk about urinary tract infection test strips.
Yes, very common with women, and this is a very useful home exam. Basically, you take this little test strip, you dip it into your urine sample, and it lights up purple if it is positive, and if it is, you still need to call your doctor to get an antibiotic.
But at least if it turns up negative, you think that it's truthful and you should be able to trust this?
This is accurate, so if it's negative, you've definitely ruled out.
Okay, so this is a do it.
This is a thumbs up, take it.
Okay, the allergy tests. How about this one?
So this one tests for 10 common allergens, both in the environment and food, like eggs, wheat, dust mites, some molds and grass. And you send your blood sample in, and then they take about a week to get it back to you, and they provide an educational pamphlet for you. My issue with this is that for environmental allergens, a better test than a blood test is a skin test.
Oh, right.
So it's not as accurate for the environmental allergens, and for the food, like the eggs and the wheat, there can be false positives. So you may not actually be allergic if it tells you you are.
So are you saying skip?
This is a skip.
Okay. Now, we don't have the next test here. It's called a chlamydia test.
Yes.
Explain that to me.
This is available free in many states at iwanthekit.org.
iwanthekit.org,
yes,
okay.
It is FDA approved, and because chlamydia does not cause symptoms in about 90% of women, it is definitely a useful test. However, I want to say that women every year should go to their gynecologist for their pap smear to get tested anyway. But in addition, if you found out a partner has chlamydia, this can confirm it for you. If you have symptoms, though, call your doctor.
Okay, let's go on to this blood pressure test.
Yes, this is something I recommend to my patients all the time to check at home. Basically, it's a home monitor. You wrap this around your arm, you press start, it digitally gives you the reading, so it's very easy, very convenient. What I use it for is if a patient has a high reading in my office and I can't tell if it's because they're nervous, I tell them check it at home, and then we can compare it and see if it's real.
There's a lot of other tests that you can get out there. There's like home alcohol tests, there's all kinds of things. But the bottom line is you really need to, this is not an alternative to
seeing your doctor.
Right.
That's right.
Okay, thank you so much. I really appreciate your being here,
Thank
Dr.
you, Jane.
Peterson.